Baby girl, you mesmerize me. I'm searching, and you finally found love. Yeah, baby girl, you take my heart away. I've been looking, and you finally found love. And I kiss with you, baby, and go school for Germany. I find peace with you, baby, and I never leave you, my lady. I wanna please you, my lady. Are you everything to me? And we can come from Germany. Give you mansion and money. Make you give me, baby. I go give you love, and I promise to give you, baby. I'll be that up of your mother, baby, God bless your mother, you took my past, mommy, mother, baby, bless your mother, baby, God bless your father, I'll be that up of your mother, baby, God bless your mother, you took my past, mommy, mother, baby, bless your mother, baby, God bless your father, you love me, make I love you, baby, kiss me, make I kiss you, baby, baby, let me love you, baby, baby, kiss me, baby, make I kiss you, baby, Lisa, Lisa, baby, I beg you, know they play me like that, Lisa, Mona Lisa, baby, I beg you, know they play me like that, hey, baby, you make you give me, baby, I go give you love, and I promise to give you, baby, love, baby, give me, baby, I can give you love, and I promise to give you, baby, I'll be that up of your mother, baby, God bless your mother, oh, no, you took my past, mommy, mother, baby, bless your mother, baby, God bless your father, I'll be that up of your mother, baby, God bless your mother, you took my past, mommy, mother, baby, bless your mother, baby, God bless your father, you love me, make I love you, baby, kiss me, make I kiss you, baby, baby, let me love. Wow. Listen, I want to go on and on and on, but I'm just thinking, oh, tonight is a very important night. And the best part of tonight is that our speaker is the same one and the same doctor that treated my uncle. Yes. He agreed. I spoke to him. I gave him a call. I said, hi, doctor. There's this talk show. He said, listen, anything for you. What? He did not even allow me to say a word. He said, anything for you. I'm like, who am I? Yes, I'm going to, let me see what the family members are saying. Oh, my dancer. Good
the admin of the page said, welcome to our live discussion on prostate cancer. Today, we will be addressing your questions and concerns. Thank you for joining us. Prostate cancer live discussion highlight and what have you. These people, they are trying me. 400. Wow, our viewers are increasing. So, family, I'm so excited. Yes, I'm so excited because tonight, as we all know, is our part 2. If you look on the screen, we are scrolling to say our part 2 of prostate cancer. Yes. Do you have a father? Do you have a brother, an uncle, a neighbor, a colleague, a friend, even your enemy? Are they male? Are they of age? Can you ask them to come and watch this live show? Please, it's very important because prostate cancer is everything male. As long as you're a biological male, I repeat, as long as you're a biological male, please, it's very important you come live and direct. Because before I invite our doctor, immediately I invite him, I will stop speaking. But before I invite him, I want to say that, yes, prostate, prostate, prostate. We hear it, prostate. What is prostate? It is very important we know what the definition of prostate is before we talk about prostate cancer. Last week, we had our wonderful speakers, 2 consultants. We are here to talk to us about prostate cancer. And part of being a male is to have your male reproductive system, which is the same thing called the prostate. Is an important part of the male reproductive system. It's like a walnut shaped organ, and it is located below, or you call it the neck. Since you guys say man and woman, head and neck, so it is located at the neck of your bladder for the men. Prostate is only for the men per se. So it's located at the neck of the bladder and is below, you can say at the neck or below the bladder, in front of your rectum. Yes, the primary function of every prostate is to create fluid in the semen. It creates fluid in the semen and it forces the semen through the urethra when the man ejaculates. I repeat, the primary function of the prostate is to create fluids in the semen, and it forces your semen through the urethra when a man ejaculates. Yes. So it's important to know that prostate is likely very important for men. It is very important for you to know that it is likely to get larger. Yes, I repeat, it is likely to get larger as one gets older. It's normal for your prostate to enlarge. An enlarged prostate simply means that the prostate gland has grown bigger. Yes, it does not mean you have cancer. That your prostate is enlarged comes sometimes with age and a whole lot of other things. I will allow the doctor that when I call him up to tell us more about prostate, but it's very important for you to know that an enlarged prostate is not, how do I put it? It does not mean you have prostate cancer. A lot of things can also make it to get enlarged. Again, I'll let our speaker to talk more on it when he comes. There is an important thing I want to say to you before we start, which is that prostate cancer can develop in tumors, some abnormal growth. So there are some abnormal growths that can be found in the prostate. However, it's not all abnormal growths that are cancerous. Like I said, I used to have growths, they will say it's benign growth. That means it's not cancerous. But whenever you have any kind of abnormal growth, it's important to seek to go to your medical doctors, not native doctors. Yes, abnormal growth could be benign, meaning it's not cancerous, or it could be cancerous, which means that it is malignant. Malignant. That is when it is cancerous. We'll talk about risk factors and a whole lot of things. But before I go on and on, I want to invite our one, let me see what the family members are saying. Welcome, my people. Yes, so share. They are trying to share. Wow, our figures are increasing. So, without further ado, I want to invite our one and only Dr. Oniwo. Yes! Yes! Family members, can you please give him a round of applause and welcome him? Yes, this is welcome everyone. Yes, this one said my network. Chijoke say, ask your question. There is some sound. Eichmann said, good evening, ma'am. And Nanshak said, welcome, sir. And Nanshak said, welcome, sir. Chijoke said, welcome, sir. And Ngozi Amaka said, welcome, sir. And Ezekiel said, good evening, ma. And a whole lot of people are welcoming you. Welcome, Dr. Jim Ike say, welcome, sir. So, good evening, sir. And I want to say thank you very, very much for honoring our invitation. Before you say anything, I want to tell you that last week, the family we gathered together to talk about prostate cancer. We started with cancer and we later on talked about prostate. And I told them that there is this doctor that treated my uncle, although he came late because I told them the stories behind. When we were asking him to go to the doctor, he was no, busy going to native doctors and all those stuff, which is something important I want family members to learn from. I don't want our family members that are busy watching to go through the same thing my uncle went through. So our doctor is here and I will allow him to introduce himself before we start. So Dr. Oniwo, can you introduce yourself to every one of us?
Good evening, Ma, and good evening, the audience. I don't know. I think the anchor of the program has said one or two things about me. I am Dr. Onibo Cornelius Onyeka. I am a consultant urologist at Nnamdi Azikiwe University Teaching Hospital, Nnewi. I've been in active practice, and apart from having some years of practice, I've also seen a lot of things, and also being an indigenous urologist, I think I will have more to share based on regional experience, what I have seen, the advice we have given to some people they took. And
Continue. Wow. No, our enemy is dead. Oh, okay. I don't know what's happening. Our doctor's enemy just came to shut him up. All right, I will try and call him directly to see. Okay, okay, you're back. You're back. Continue, sir.
yeah,
Continue.
so I have said, I don't know which aspect I have said, I've introduced myself. Did you hear the introduction?
Yes, we
What I
did.
said?
We did. Yes.
Yeah, so I said my experience in this area, both the advice given to some people, they took it, and those ones that rejected it. So the benefits and the consequences, I think they will be useful to us tonight. As the Nurse Angel said, prostate is a very important organ in the body. It's an accessory organ of reproduction. Without prostate, you cannot say to be fertile as a man. But everything that has an advantage also has disadvantage. So prostate is a friend, but occasionally a friend you keep. As time goes on, it may also turn to be an enemy. So it is the aspect of the enemy that I want to talk about, so that you will find out when your friend has turned to be an enemy, and they find out how to sort him out. So if I may continue, as she has said, it is a chestnut. Some people say
Can we
walnut,
ask you
chestnut.
question and answer? Can it be
Yeah,
question and answer so that
yeah, yeah, yeah.
we will follow? We will follow.
Yes,
Yes.
yes.
So yes, like the doctor said, prostate is a friend, but it can become an enemy. And again, we hear prostate cancer, prostate cancer. Most people, whenever they hear cancer, if no nothing, as long as they hear, including me, if we hear cancer, what we hear is death because of the struggles.
The experiences people have
Correct.
had.
But sir, I know that there has been a lot of advancement. There has been a lot of progression. There has been a lot of discoveries. And there has been a lot of technologies. And there has been a lot of research and also positive discoveries. So do you want to, first of all, let me ask you a specific question. Is there a cure for prostate cancer? You're muted. You're muted.
Prostate cancer, just like other cancers in the body, have cure. But the
Ooh,
issue is, did you find it out on time? Is it early? Is it late presentation?
I'm
Yeah,
dancing. I'm
yeah.
dancing
It's not
because,
a
okay.
death sentence. Prostate cancer is not a death sentence. Yeah.
So,
Did it come on time? Mm.
you are saying to the family members, about 800, even 1,000 people, because not all of them are registered, some come and go, watching you, that prostate cancer can be cured depending on
Yeah, the
whether.
time of presentation. Time of presentation.
You see, sir, we always say to family members, early detection matters. Early detection matters
Yeah,
in health and in life. Yeah?
yeah,
Um,
yeah.
you just said it that it can be cured based on when it was discovered and what's not. Another question I will ask you is, when is it? Because, sir, let's be honest, prostate, as we know, is a man disease. A man. That doesn't mean all men will have it, but a woman will not have it because a woman does not have prostate.
No, they
Yeah.
don't have
So,
prostate.
sorry.
You are correct.
Correct. So
Yeah,
I'll
it
be
is.
okay. So now, if prostate cancer is a man disease, and if prostate cancer can be cured, why does it kill? It killed my uncle. It killed my uncle. Can you talk about, you've talked about early detection. The next question I want to ask you is, men generally don't generally don't usually visit the hospital. Women most likely visit hospital more than men because, I'll be muting you unless you want to speak. I can hear sounds on your background. So, because as a woman, most time we start with our menstrual pain, pregnancy. You see, things that lead us to hospital. And in immediately you are pregnant, they do a lot of tests on you. Yeah, but men generally don't have things like that to take them to hospital. And you and I know that prostate cancer, the signs and symptoms does not come until it starts to hit, until it develops, until it is so, it's now bad that it starts showing you signs. So when you say early detection matters, oh, I hope he's not. I hope he's not. Yeah. So when you say early detection matters, how will men be detected early if number one, the signs and symptoms does not start until it develops? Number two, men they don't generally go to the hospital for checkup. How can it be discovered early? You can speak.
Okay. From what um, in African environment is a different thing altogether. Even some people, when they develop symptoms suggestive of prostate disease, and when we talk about prostate disease, we are talking about benign prostatic enlargement. We are talking about prostatitis. We are talking about prostate cancer. Now, in Africa, in our environment, many people, even when they develop these symptoms or the signs that they have this disease, they will first of all go to where they are giving them injections, say they have urinary tract infection, they have staphylococcus. So it's actually a problem of misconception. Some of them
Sorry,
will
sir.
go
Sorry,
to,
sir. Sorry. We don't want technical or medical
okay,
terminologies.
okay.
Break it
So,
down for us, please.
yeah, so I said now the prostate disease actually can present with some symptoms. And even when people have that prostate disease, it may still be fairly early presentation. And this is signs or the what somebody will see and know that he has this prostate disease is what we divided it into what we call storage symptoms. Something like somebody is passing urine on and on, that is frequently, we call it frequency, or that the person has what we call urgency, that when he feels to pass urine, he cannot delay to pass, he cannot hold it back. So we call it urgency. Occasionally, and the person may be passing urine after he has gone to bed more than 2 times in the night before he wakes up in the morning. We call it nocturia. Now, these are the storage symptoms. Now, when we talk about voiding symptoms, we talk like something hesitancy. When somebody comes to pass urine, the person has to wait or do delay before he starts passing urine. Yeah, we'll call it hesitancy. Or when the person is passing urine, the urine is weak. It's not coming out the way it's supposed to be coming out. There's some people who attribute it to old age, that they are getting old. And because of that, what they are attributing it, they may not go to the hospital. Rather, they may say, they have one infection, they have this, they will go to pharmacy, take drugs. Meanwhile, the prostate, if it is prostate cancer, it will keep on, spreading. So, and some people in our environment, I have met a patient, and when he complained to his brother that he's having difficulty with passing urine, the man gave him his own tamsulosin. Meanwhile, the other man's problem was ordinary prostate enlargement, benign disease. Now, his brother that has cancer of the prostate collected the tamsulosin, the drug that used to make people to urinate better, people that have prostate disease. The man was taking the tamsulosin for almost 1 year, and because the is still part of the prostate, so the tamsulosin was helping him. But by the time he presented to the hospital, the cancer cells have spread all over his body. In fact, he was now working with walking stick, and this has taken up to almost a year when he started having symptoms. Now, but the ideal thing is that any person that doesn't have family history of prostate cancer, by the time he is about 50 years, he will be going for checkup for prostate health, for his prostate health. And this checkup is that he will do his yearly prostate specific antigen.
Okay,
He should
sir.
ideally,
We'll come to the text from
okay.
50 years. We'll come to
So
it. There are certain things you talked about. I want you to expatiate on
break
it.
down, yeah.
For example, you talked about someone going to a friend or someone they
Correct.
know and collecting that
The drug.
medications that is specific for those people, and they are taking it, and that is, it appeared as if it was helping him. It appeared as if it was helping him, but it was only helping the symptoms, not the disease. And the disease had enough time to be enlarging and spreading and going
Spread.
to, yeah. So the question now is this, answer. I love the way you introduced yourself. You introduced, before I ask you the question, I want to show you this. Yeah. I want to show you this. So, sir, I want the family members to see this. Family members, if you're watching, I want you to look at this. I'll remove the, yeah. So on the screen is what our lovely doctor has been talking about. The one on the right hand side that says normal prostate is the normal prostate gland of the man. The one at the right hand side that said enlarged prostate is what it is, enlarged. So, sir has been talking about people with an issue with their prostate. So, a lot of things can be an issue with the prostate. It could be that it's enlarged and benign, and it could be enlarged with some tumors that are cancerous. But you need to visit your doctor individually. Do not go, because people, again, prostate, which is man thing, has different things that it can cause. It could be it's so enlarged, it's not cancerous, but the symptoms are the same with a cancerous person. What do I mean? Maybe you see how it's so enlarged. If you look at the normal prostate, you will see an opening. Please, family members, take a look at the picture. If you look at the normal prostate, you will see an opening. The opening is, I will allow the doctor again to explain what it is. But you will see that opening is the urethra, which is where the prostate is underneath, or call it the neck of the bladder. Call it the neck. Yeah. I want you to look at the normal prostate. So you will see the bladder is like a head. Then the prostate is the neck. Then the thing in between, like an opening, is the urethra. Yeah, that is where
Like a tube. A tube.
like a tube. Thank you. The thing like the tube, sir, maybe I will allow you to go on. Do you want to go on since you're muted?
You're saying it well. Just continue.
So the urethra, which is like the tube or the opening, I see it as an opening, but the doctor is using the medical term, like a tube, is what takes the urine or the semen down to the penis. Yeah? Men, please, wives, if your husband is beside you, tell him to listen. Very important. Very important. Please, I mean it. So, when the man is like, oh, I want to wee, what does he do? You see the head, the bladder. You see the neck, the prostate. You see the opening or the tube-like is the urethra. Yeah? That's where it pushes it. The prostate helps produce the with the urine to flow. and maybe if he wants to ejaculate, that is the same place it goes. Either urine or ejaculation passes through that urethra. Yeah, and he will either wee or release semen. Yeah. So if you look at the right hand side, family, very important, especially if you're a man. If you look at the right hand side, there has been an enlargement. Number one, you need to know that old age causes a kind of enlargement. Again, tumors, growth causes a kind of enlargement. And as I said, old age as well, or abnormal growth. Yeah? So if you look at the one on the right hand side, I'm as if I'm screaming because it's important. You will see that the opening you notice at the left hand side is not the same at the right hand side. The enlargement, which can be caused by anything and anything, like it could be a growth, it could be old age, it could be doctor will put more light on the causes, has now shrunk the, according to him, tube or opening is now so narrow. That is why when the bladder becomes full, remember, nobody is talking about cancer yet. We are just talking about enlarged prostate. When the bladder becomes full for the man to urinate, just take a look at the left hand side. The urine will just go wee, wee. If you look at the right hand side, the urine will not go. It will be it will be difficult for urine to pass through the enlarged prostate. Worst of it all, remember, call your husbands, call your brothers, call your daddies, call your neighbors, your friends, your colleagues, tag them, tell them to come. Is important. So when they want to urinate from this enlarged prostate, urethra is now shrunk, it will be so hard. Not just will it be hard, it will start dropping, tin. Something that he used to do is now so hard. It takes time. Look at it now. Just take a look at it. Again, let me show you. This is it. Now, the next picture I'm showing you is now to show you what can cause the enlargement of the prostate. You see now, this particular one is showing you a cancerous tumor. A tumor that is cancer, like the white one we saw in the model that Dr. Jonathan showed us the other time. So you see this white tumor, which is cancerous, when it starts to increase and increase, definitely begins to shrink as well. So what am I trying to say? What I'm trying to say is that the enlargement could be just a normal benign enlargement growth. It will still cause the same thing the doctor has just explained to you. So that is why someone that has a large benign prostate is having some medication to treat it, which is helping him. The same person, another person that had cancer, which has led to the enlargement again or something, difficulty, sometimes it's the same symptoms. He's taking what they gave to his friend and he felt it was helping him, but he didn't know he was allowing the cancer to grow bigger and bigger, to the extent that when he came to the hospital, like my uncle, it was almost too late. So, doctor, now you talked about enlarged prostate and also cancerous prostate. Do you want to tell family members? There is a question I asked you, but I'm not happy. The network should bring her back, please. So there's something Dr. Onibo was saying. I'll just call him on the phone because irrespective of the fact that we all know about cancer, it's very important for you to hear from the horse's mouth. He is a neurologist. Neurologist is an expert in terms of everything reproduction, your urinary. Urologist has to do with you, urine. That might be, but I'm not laughing. Let me give him a call and see if we can hear from. Okay, he's coming back again. Let me turn off the call. Doctor, we cannot allow this to happen to us. Network must free you. Fantastic. Wonderful. So, sir, please can you tell us before you go into the treatment of it, can you tell us, sir, um, the signs and symptoms? First of all, tell us the signs and symptoms. But there was a question I asked you before. I think you jumped it. The question is, um, men don't usually go to hospital like women, and women go because of certain things. So you talked about importance of early discovery. So what do you have to say to men? How can they discover it early when the symptoms and the sign don't come quickly? So tell us, what do you have to say to a lot of men and women so that we can also tell our partners when should they go to hospital? For men, I know you talked about age from 50 years. Well, let me tell you the truth, doctor. A lot of, not a lot, some men that are 40 years under the age of 50, they have been diagnosed of he's disappeared again. They've been diagnosed of prostate cancer. I have a lot of people I know that are 40 years, even sometimes late 30s, and they have prostate. Let me call him directly. I have to call doctor because network is not doing him well at all. So let me call him directly for him to give us a talk, serious one on this. Oh dear me. Hmm. Number is busy. What's happening? I think he's trying to come in. But I want him, I don't think I want him to come in anymore. I just want him to talk to us on the phone. Family members, if you have questions without seeing the doctor, what are the early symptoms? Fantastic. Okay, okay. So, doctor,
Hello?
thank.
I'm trying to use my wife's phone to connect. I don't even know why the network. Just give me 20 seconds.
Okay, that's fine. Thank you. So he really wants, and I like that. Our doctor really wants to come. I think he's a lovely man. He's a lovely man. Why do I say so? I know when we rushed my uncle from a previous hospital he was into him, he was really worried. He was really worried. And so were we, the family. He was worried because yes, my uncle came late, but remember, it was not easy. And I really want family members to listen to me. A lot of people think they are stronger and more mature than disease. Men don't go to hospital. I have sons. I have a father. I have a husband. I have brothers. I have friends that are male. And I'm not happy because I don't know why we should lose our lovely brothers, husbands, fathers, sons, uncles, friends, colleagues, even our enemy to prostate. You see, the doctor said prostate is curable. If you see, when people hear cancer, oh, I'm dead. No, you're not. heartbroken because there are things that are curable. We've said this now over and over again. Early detection is the key. Early detection is key. What do we do? What do we do? What we do is, oh, I cannot, people don't, nothing is wrong with me. Nobody is saying something is wrong with you. But prevention, they say, is better than cure. Prevention is better than cure. Okay, if we can prevent it, so remind me, family, remind me, be typing it, prevention. We should ask him the prevention as well. If we can prevent it, early detection is better than late detection. Remember, prevention is better than cure, but sometimes, let's be honest, it's very difficult to know what causes cancer. Even as at today, 2024, cancer, the causes of cancer is still very largely unknown. If you ask anyone, they'll say, oh, we are still, it's unknown. However, old age, what causes cancer in old age? Unknown. They will say it's because the prostate is, but what causes it? Really, really unknown. So they will say black men. What makes black men? Because family members, 1 in 4 black men. So that means if you see 8 black men, 2 of them will have cancer. If you see 4 black men standing, 1 of them will have cancer. That is what the statistics is saying. And it is very alarming. 1 in 4 black men will develop cancer, which is as against 1 in 8 white men, and which is also against 1 in 13 Asian men. Why? Why? What have black people done? Why? Why? After all, we say we are organic. We eat organic food, and the white people eat chocolate. So if it's about food, we think, oh, we try our best in food. But they say food and plants as well. If you look at Asian society, like Chinese, you know how everything about them is seafood or plants. Seafood or plants. But whilst we wait for the doctor to come in, I want to repeat that 1 in 4 black men will have cancer. If you know any family of 5, 1 of them will have cancer. Family of 8, 2 of them will have cancer. Oh, no, Senje, you're wishing. I'm not wishing. The statistics is telling us. If that is the case, where are our men? Men, where are you? What are you doing to prevent or cure it? Men, what are you doing to prevent or cure it? Let's detect, because you see, a lot of people, doctors I know, everyone they say, oh, prostate cancer is an easy thing to cure. Oh, prostate cancer is an easy thing to cure. However, it is only easy when you detect it early. So doctor is back. Doctor, I just showcased your picture because I love you. You're amazing. So I'm using your picture to represent you before you come back. So doctor, talk to us. Don't worry, your wife knows I love you. I know you're looking at her. So doctor, because when I was trying to reach you, I didn't get you. I called your wife. I said, oh, ma, please, I'm dying to talk to doctor. I have something with him. And it's true. So doctor, talk to us. One thing I want you to break our men, break them. You're a man. Talk to your fellow men. Most of them don't go to the hospital. They don't. And you talked about early detection. They don't go to hospital, 1. Number 2, the signs and symptoms. When it comes, that means cancer has started working, meaning it's now entering almost late stage. So can you tell us, how can men that are listening to you get checked? And also, what are the signs and symptoms of cancer, prostate cancer? Thank you, sir.
Thank you. I'm sorry. I'm having
Oh,
challenges. I'm also trying to log in my wife's phone.
yeah, that's
Um, Now, the issue is that you should understand the nature of men. You should understand the nature of men. Men are created in the image of God, and they have that feeling that nothing is happening to them. Yeah, it's that thought has advantages, and it makes them not to lose their fatherland and their inheritance. But the other disadvantage is that it makes them not to believe that anything can happen to them. So by the time a man tells you that he's sick, just know that the
is
problem
dying.
is almost killing him. The real man, the real African man, just know that he's almost dying. So, so you should not be surprised. Many men that come to hospital in our setting is their wife that will drag them, because the wife will see that they're getting up many a times to go and pass urine, and they waste unnecessary time in the convenience, in the restroom while they are passing the urine. So the woman will feel, this man. And it may take the woman 3 months to 6 months to talk about it before the man will agree to come to hospital. In fact, let me say, majority of the patients I see that has prostate cancer, it is their first time of coming to hospital. Many men, and they don't go to hospital. They don't know their blood pressure. They don't know whether they have diabetes. They don't know anything. Now, the issue is that for most people, by the time they start having symptoms that can now show that what is happening to them is cancer of the prostate, it is late presentation. They are coming late. So,
Hi, Jesus. No, 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 no. Listen, sir, please, if you can hear me, I want to call you directly for God's sake. I don't want this thing that is happening to continue to happen. I want to call you directly because this topic is important. Let me call him directly. Ah,
Dear customer, the MTN number you have dialed is not.
Chineke na mie. Let me call his wife. Ah, hey. You see, our enemy is, you see, Wahala no go there. Let's see. Hey, Pastor Pat say network don't do this because I agree. But he needs to pick up the phone. Anyway, some men find it difficult. Yes, sweetheart.
madam, what do I do?
No, what you will do, speak from here, sir. Please. We cannot afford to waste we need you. We need you. So speak from here. Family members will hear your voice while I put up your picture. Please, sir.
Okay.
Thank you, sir.
If I from here, can they hear me?
Hey, they are hearing you loud and clear.
Please try to take a cup of water.
Yes.
Okay. So I say now the ideal thing, by the time you can differentiate from signs and symptoms of pattern prostate enlargement and prostate cancer. That prostate cancer is an advanced prostate cancer, a prostate cancer that has spread to other parts of the body. So the ideal thing is that people should be detected before symptoms start, or as early as possible, they start having challenges in their urination. By the time you can now ask questions and find out that somebody
is having low back pain, which can actually say this is the difference between ordinary prostate enlargement and prostate cancer. It means that the cancer has spread to the bone of the back.
Wow.
And by then, it cannot be cured again. The only thing we can do is palliative. Palliative is to handle one or two problems while the person is heading to grief.
Chai.
Or maybe the person is having a problem with passing urine and now develop weight loss. The person is losing weight, has started losing weight, or the person develops loss of appetite. Because most of the patients we see here, they come with weight loss and a loss of appetite and back pain. In fact, some of them will come with inability to walk. It will start with back pain, low back pain, until they are finding it difficult to move their legs. They will be using walking stick, and before you know it, they cannot walk again. Either they will say their cousin or their uncle has put poison in their farm, or in where their son is building a house. So with all those distractions, they will not come to hospital. By the time they are coming on wheelchair.
Thank you. So let's quickly talk about my uncle. So family members, we are going to talk about two cases. One is a case where it was a late case, and another would be a case where it was an early case. So, sir, you are aware, if you will remember, I know it's almost like 4 years ago. I remember him every day, honestly, because you know how there was a medication. If you remember, sir, it's quite a while because that was 2020, and this is 4 years ago. So there was a medication.
Yeah, Abiretarol.
Okay.
Yeah.
How much was that medication?
You bought from Johnson. It's Johnson and Johnson company.
Thank you.
It was 250,000 then.
Yeah, then it was yeah. So can we
250,000.
It was it? Okay, I brought it up.
Now.
Yeah, go on.
Now it should be like they accompany their own drugs because they are the producer of the main, that is, they are the first producer of the drug.
Okay.
Yeah, so their own is costly, and I think it's a UK drug.
Yes.
UK produce.
Thank you.
So like now it should be like 600,000 naira, 700,000 naira.
That's cheap now. Then when I Googled it, it was about $7,000. Very expensive at that time.
So I don't know what it may be in naira now, but I know it's very costly.
Yes,
very
costly. It is very costly.
Very costly.
Yeah.
But some of our patients now, they will give the same drug. They take the Indian product. Indian product is like 120,000, 140,000, and it's working. Okay. It's working.
Before we talk about that, please. You know, you have a lot of information you're dying to give, but the more you push it together, we don't get it. I need us to break it down. So you talked about late presentation is what you see, and I agree. Late presentation is what you see, and then it will be an advanced prostate cancer. You talked about the ideal thing to do is to come early. Now, sir, before we talk about how to find out whether you have cancer or not, you spoke about the fact that most people will come to you and say it's their uncle. People put some jars in their farm. I will tell you this. A lot of people, when I talk to them as Nigerians, this is very peculiar to us. They will tell you that someone voodooed them cancer, someone voodooed them leg pain, like because my uncle, he refused to go to hospital until he started limping. My uncle, he's to you he's old, to us he's young, because he's my dad's last born. He's the last born of my daddy's mom. So to us he's young. So he was limping and walking with a walking stick. So what did we do? He's been not well. He will be asking, oh, I'm not well. They will say someone is killing him. This one is killing him. That one is killing him. Go to hospital, they won't. They'll be going to like natively to find out. Then when he started limping, borrowing from what you said, we now had to take him to orthopedic hospital to find out the cause of his limping. That's how we started. And that was when they discovered he had cancer. Yeah. Then they brought him back and took him to a private hospital that kept him for almost a month, just giving him blood. Everybody was donating blood before we now had to rush him to Nnewi Clinic where I met you. So can you tell us, sir, this late presentation, what would have been done if my uncle came early? And what did you do when, because there was a time you started saying to me, let's try this, it's 50-50, 10-20, 30-40, let's try this, which is fine. I was ready, then. Anything that will keep him alive, even if it's to sell my everything I had to keep him alive. Well, we came late, and I know, because I was not happy as well. So what would have happened if he came earlier, and what happened since he came late? Can you tell family members, please?
Okay. When he came late, let me start from the way he came. When he came late, normally, what is done here, what we call androgen deprivation therapy.
Can you speak louder? Can you speak louder? Yeah, and also break your medical terminologies.
Yeah. Now, when people come late, normally, what we do, offer them what we call palliative treatment, a treatment to reduce the burden, the problems they are having. Because when you look at your uncle there, he was having back pain, low back pain, that was affecting the way he was walking. Now, he was having shortage of blood because the cancer cells have taken over blood-producing cells in the bone. The cancer cells have gone into the bone marrow and they replace blood-producing.
Okay, I see you here. I see you here. That's fine, because you're speaking from both places. I think you're not.
I don't know which one, if this can be sustained.
No. Let's use the phone if you will agree, because you tuned in, we are hearing you doubly.
So let me off the other one.
Off the other one. Let's listen to.
Yeah. Do you understand the idea of losing blood, giving blood every month?
Yes.
Or your brothers or the audience understand why they were giving him blood?
So you said, I want you to repeat it so that we hear you, and I want you to say it loud and clear. And I want you to be loud, audible. Yes, we can hear you.
Can you hear me now?
Yes, we can hear you.
I said, when people come late, what we do is to give them what we call palliative treatment. Like during the COVID in Nigeria, people were being given a carton of Indomie. A carton of Indomie cannot do anything for a family of 5 or 6. So that's what we call palliation, to reduce the problem the person is having. It is not taking away the problem completely, just to reduce the problem. And one of those problems, as I've said, is bone pain, low back pain that was coming to the lower limbs, making the person not to walk. When the palliative treatment is given, something like removing the testes or giving the person injection that works like removing the testes, that low back pain will start reducing. That is palliative treatment. And when you do that, the cancer cells have taken over the bone marrow. Everybody knows what is bone marrow.
Yeah.
When you break a bone, you see something soft inside it. And that is where blood is being produced. So that when the cancer cells will come, they will enter what we call metastasize. They will spread into that bone marrow. The person will be having shoulder pains, Now, those bone marrows will be replaced by cancer cells. The person will stop producing blood. And that was why your uncle was being transfused every time. Now, when we do
Hey, Chileke Nami. Oh, let's try him again. Okay. So, so happy with this topic, honestly. Um, I hope you will pick. So,
I don't know what happened.
yeah, don't worry. Our enemies are sick.
Okay. Should I continue?
Yes, sir. Please continue. You're amazing.
Okay. Now, I said what was done for your uncle was to give initial treatment we call androgen deprivation therapy, which is palliative treatment.
Mm-hmm.
I think by then he was given orchidectomy, the removal of the test.
Mm-hmm. Yeah. Hello? Oh, Jesus.
When you remove their testes, or you give injection that is equivalent to removing their testes, which is called goserelin and other drugs. Now, what will happen is that the cancer cells will reduce. Some of them will die. Those ones that didn't die, they will begin to find a way to survive without the testes. After some time, they will now come back in a great force. And it was when they came back in a great force, that was what you brought, when your uncle was brought to us. And I know it was then that your father made the effort to come home to see him. All of you people sent money, and we bought the abiraterone. Abiraterone is actually used for second line of treatment for those people, their body has rejected the removal of the testes or injection. So that was the drug that was bought. And your uncle, I think it took it like 3 to 5 days.
1 minute, sir. 1 minute. So when I came and I saw you guys give my uncle the tablet and he's throwing it away, I started crying. Because the tablet that we were hoping we help was the same tablet his system was rejecting. Are you aware of that?
Sorry, what did you say?
I said when I came back, we had to come back for my uncle's case. And when I came back and I saw the nurses give him the tablet, and as he was about to take it, he threw it away. Like not that he threw it away, but he vomited. That he coughed it out. He couldn't swallow the tablet. I started crying. What happened? Are you aware of that?
No, I'm not aware of the by threw it away, but I know from the time you brought it to his death, I think it was 3 to 5 days or so.
Yeah, but he was not really swallowing it. When he wants to swallow it, it comes out. He throws it out. It's not that he throws it away, but I don't want to say he vomited it. Yeah.
It may happen, but he was very ill then.
Yes.
We were just trying to see what can be done.
Yes.
No, he was very bad. Even by the time he came to us,
yes,
I kept, when people came, and I think the son, the one that works with the drilling company, is he in this program?
Yes.
Okay. I kept telling him that
his wife is in the program. The wife is listening to you as well. My uncle's wife.
I told him that whatever we see, we should take it. Like anything can happen, no? Yeah. And even before you bought the drug, that was what I
told me. Yes. Hello, sir. Please, network should free us. Please, network, free us. This is very important. Look, sometimes if you're not, we don't wish anyone, but you need to be in. And the system, like he that wears a shoe knows where it pinches. So people say, oh, his shoe is pinching him. Oh, they did, but they won't know how it pinches. and where it pinches. Unless you're wearing the shoe. I can't believe my eyes and my ears that this network is not, this is like a direct call. Yet the network, yeah, good.
Sorry, is it the network or your data?
No, it's not my data. I filled up the data.
Okay.
Yeah.
So that is the case for because there is something I found out. It is also written in the book that the prostate cancer has a way of 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 stages. Like somebody may have prostate cancer this year, it may be what we'll call ISOP 1.
Yeah.
If he carries it for more 2 years, it may go to ISOP 3. So the disease will keep on changing from less aggressive type to more aggressive type.
Yeah. Yeah. So I hear you. Another thing I want to ask you before we talk about the one that is treatable is the fact that can you tell us what stage was my uncle's cancer when he came to your hospital? Hey, Jesus. What's happening? I don't know what's happening, but we'll keep on trying. Let me try him again. So sorry, both me and the doctor I'm affected by cold, and the doctor is by the network. But the show goes on. Oh. Good. I'm so sorry, guys. Yeah, so sorry, guys. Our enemy is sick. What's happening? Okay, so probably before we get the doctor again, I want to remind you that I want to let me leave him for a while. So it's important, family members, to know that the cancer as at today is difficult to find out what causes cancer. But when you ask what causes cancer, people tell you, as I've said it before, the risk, the potential risk for cancer development. And part of what they say is risk of developing cancer. Number one, you have age. The older you are, the higher the risk. Number two, race. And remember, while 1 in 13 Asians develop cancer, 1 in 8 white men develop cancer, but 1 in 4 Black men develop cancer. You will ask why? I'll say, I don't know. The research is still ongoing. Another risk factor is family history. Yes. So if you have a family, any family that either their father, their uncle, their son, brother has cancer, or even maybe suffered from prostate cancer, or even their family had kind of like their mother has breast cancer, is highly likely to develop cancer. So family history is one of the potential risk factor, especially if you have a family member that developed cancer. Therefore, all of us, including me, my brothers, remember my daddy, his brother died of cancer, and himself, he has cancer. So all my brothers, we also are risk factors, and my uncle's children. Is important to be detected early. So family history is also a high risk. Another is obesity. Currently, they've somehow tied obesity to cancer. If you're obese, thank God for in our Mind Talk show, we are currently doing weight loss program because obesity has the BMI cutoff as well. So when we hear obesity, we think of fat. No, sometimes you don't necessarily need to be like this to be obese. Me, I'm clinically obese. I'm obese as I am like this. Yes. Yes. So obesity is checked according to your height and your weight. And there's a cutoff. Yes, they know black people, we always argue, we are black, we are fat. Therefore, our obesity is not the same with white. But there's a cutoff. So because we are arguing, we are always big. How do you get big? Is it not other black people that are slim? Oh, we have big. Just try and maintain. They say, no, men need something to touch. Touch what? What about your health? I'll be touching. What is touching? What about your health? A lot of men will say, I like women at the big size. I like men that have big tummy. These are diseases. I'm so sorry, but it is. It is. Oh, if a man does not have pot belly, he's poor. It's a lie, he's healthy. If he doesn't have pot belly, stop tying obesity to wealth. It's so wrong. Please, let's not do it. And another thing I want us to know as well is that we should try and eat healthy. Let's see if we can get the doctor. Oh, fantastic. Doctor, I don't know what's happening tonight. Hello, sir.
Yeah, I'm sorry. I don't know. I think it's a network on my own side.
That's fine. Your phone is not going at all. But let's talk quickly because of time.
Yeah, I actually have to come in front of my house.
Yeah.
So that to see if the network is the problem.
Okay.
So I said, yeah. So I just said your uncle presented late to where he was first treated. The person treated him actually gave the standard treatment. But what we saw was a second stage of advanced disease, and we'll call it castrate resistance or castration resistance.
Okay. That is exactly what Dr. Jonathan said. When I asked him a question, you were not here. He said it was he probably resisted. It's castration resistance. Continue.
Yes. You know, medicine is a universal.
Yes.
It's a universal. They use universal language. But the problem is that because our people come with advanced disease, and that advanced disease will always come with a high grade. You know, I was talking about grade 1, grade 2, grade 3. So that most of our people come with a high grade, grade 4 or grade 5, which are high grade. So when you offer removal of the testes or you offer injection, within 1 year, the person will come down with castration resistance. And it's just like what Jesus talked about. An evil spirit was cast out. It will go out after one dream. I come back and see that the house is in order. It will go and bring more
evil spirits,
demons, 7 demons that are wicked than the initial one. So the cancer will now come with castration resistant prostate cancer. It means that removal of the testes cannot affect the new
generation of cancer there. So they will now come, strike the person, strike the way he eats, strike the bones, strike everywhere, worse than the way the initial cancer. But the advantage of what is offered to the person, I think the person may have 6 months to 1 year to 2 years of living. I'm thinking that the problem has gone. And it is a challenge in our environment. Some people, they're not bother to tell you that the problem has not gone. It is resting to come back.
Jai.
So that's what.
So, sir, I remember when I was still in UK before we had to make our way. I was asking you, I said to you that I want to start doing papers for my uncle to come abroad for treatment. And you couldn't. You said my uncle was so sick that he cannot survive to be transported abroad. Is that?
Yeah. Now, let me tell you, there is a man, is from this Anambra State, let me not mention the fact.
Yeah, speak louder, sir. Speak louder.
Can you hear me now?
Yes, but speak louder.
The man in Anambra State, the man is 72 years. He's a lawyer, and he went somewhere. He came with an advanced disease because our people, that somebody is learned in our environment, does not even make the person to think well in terms of this issue of going for prostate screening and all this. It might be poverty of financial poverty, maybe poverty of mind.
I agree. Poverty of the mind. Continue.
Yeah. So the man came down with cancer of the prostate. He went. Somebody removed his testes. He went to UK. At the place, I think he went to Liverpool. They examined, and the doctor advised the daughter that the man should quickly go back to Nigeria before he died in UK. Because what they saw after the removal of the testes, within 1 year, the cancer cells had spread to the liver, spread to the bone, spread everywhere. In fact, when they did CT scan, did a lot of investigations, they were amazed. It was like something that they don't see often. They were afraid. They told the doctor that she should better take the father back to Nigeria before he died in UK. So the man was brought to Nigeria, and when he was narrating to me, somebody gave him my contact. When he was telling me all his woes, he tried to criticize the doctor that removed his testes. I told him no, that doctor did what he's supposed to have done. You know? And I told him that the problem is his mindset. And when he came, I placed him on this Indian laboratory for 6 months now. When he came on wheelchair. When he came to see me, he came on wheelchair. But now he now works well. And when he went for a meeting, this case name meeting, they were saying, hey, God, please, any person that is sick should also recover like the way their brother has recovered. Not knowing that the man is on a drug that cost him about 120,000, 140,000 a month. And every time he stops that drug, they will go down. So the challenge we have is that our people come very late when curative treatment cannot be given.
Curative treatment.
So curative treatment. So they only get again.
Let me ask you quickly, because I'm not worried about time. I'll be rushing quick. You talked about curative treatment, but before we talk about that, can cancer be prevented?
Yes.
I'm not talking about cure. Can cancer be prevented?
Yes. Prostate cancer can be prevented, but you know, when you talk about prevention, there are different levels of prevention. There's what they call primary prevention, secondary prevention, and tertiary prevention.
Correct.
When we talk about primary prevention, is to stop the lifestyle modifications that will stop the disease from not coming. That is primary prevention. And for prostate cancer, and you know, for primary prevention, there are some things you can do to reduce the risk factors But there are some risk factors you cannot reduce.
Correct.
Take, for instance, prostate cancer is more in black men.
Yes.
So you cannot remove yourself from being a black man
Correct.
if you are really a black man. So that risk is always there, even when you attend to some other.
Sir, can I ask a question on that risk? Because before now, we've mentioned it a million times. One is old age, one is black in terms of race, one is family history. Yeah. So in terms of black, why? Is it because black men have a particular lifestyle? It doesn't have to be tied to, because Asian is 1 in 13 Asians. Is it because of their lifestyle, which involves eating, drinking, and a whole lot of things? What they eat in an Asian country like China is like fruits, veg, plants, and seafood. Is it a lifestyle that has to do with the race?
I may not say clearly. People have attributed it to genetic makeup. You know, even though all of us are human beings, they know they are varied genetic makeup.
Yeah.
So even our people that are located to the Western world, or even to the Asian world, or even those are people that are born there, they still have higher risk than the white.
Let's put it this way. There has been Chinese people that relocated to UK, and their chances now started increasing, unlike the Chinese people in China. That was why I was asking.
Yeah, it can increase, but it will not be the same with the black.
Okay.
Yeah, if you expose two of them to the same diet, the same lifestyle, the black will still have more.
So why do you think is the case for the black man?
So I think it's genetic, it's gene, the gene. Yeah, the gene. Take for instance, there was something I was reading about testosterone. They found out that the testosterone of the black in one part of America is higher, the testosterone level is higher than other races.
Okay.
Do you understand?
Yes.
Yeah. So these are some things that genetic.
All right.
They are just So the
prevention.
The primary prevention, as I thought, is apart from the ones that are modifiable and non-modifiable.
Mm-hmm.
The non-modifiable is that if you're a man and you're getting older, your risk is increasing. If you're black, your risk is increasing. Then the modifiable now is in the diet.
Fantastic. Before you go on, they have tied obesity to cancer. They said one of the risk factors is now recently obesity. So continue, sir.
Yeah.
In terms of prevention.
Obesity. People have talked about it in prostate cancer. But what I have seen in our environment, I've not done a study there, but both the flea and the pig, many of our people are not even obese. Many of our people are not obese. You know, they have similar risk. Now, the people now talk about diet, and this diet is not when the person has developed symptoms.
Sorry, sir. What do you mean by many of our people are not obese? What do you mean by that?
No, I mean most of the people who treat for prostate.
Okay, thank God. Because I was worried when I heard that. I said, let me clear it. Continue, sir.
Many people who treat for prostate cancer are not obese.
I agree.
Their BMI.
Okay.
Yeah. So I cannot really say that obesity is a challenge in our environment.
Okay.
Now,
when you say in our environment, you mean in your hospital?
Yeah, in our locality. Okay. Yeah, in our locality. Anambra, Enugu. Yeah. Many men are actually not obese. Enugu, Anambra.
Sorry, sir, they are. Sorry, sir.
Men.
I hear you, they are. Well, you know, obesity have this BMI. You know, most times we look at body for obesity. No.
I said when we calculate their BMI.
Yes.
When we calculate their BMI. Many of the people we treat for prostate
You
cancer,
treat, correct. I like that, and I agree.
Now, what people are advised to do is diet modification.
Okay.
And that diet modification is not when they are sick. It's not when they start having symptoms of prostate disease. No, it's starting on time.
Okay.
Yeah, because if the cancer forms, what diet may do is to delay the onset of the symptoms.
Fantastic.
And this diet, people are encouraged to take a lot of fruits, vegetables. Those things have antioxidants.
Fantastic.
To reduce the progression of prostate cancer.
Continue.
All types.
Sir, please, I want you to repeat it, because a lot of family members have been asking each time we have a speaker. They ask them, is there any prevention and cure? Is there any prevention and cure? Can you speak louder, sir, please, regarding that?
The diet issue, as I said, fruits, all forms of fruits, all forms of fruits, tomatoes, avocados, this pumpkin, fruited pumpkin, watermelon, all forms of fruits and vegetables, because they contain antioxidants that help to reduce the carcinogenicity of some things we eat. Then, people are advised, like at my age now, I have to take milk. People should reduce milk intake.
Sorry, they should reduce what?
Milk.
Ooh. Continue.
Yeah, it's in fact milk and red meat. Red meat. Now, but the challenge is that do we really eat enough red meat? That would be a risk factor. It is not yet answered. People should reduce milk intake. I didn't say they should not take. The dose your body, each person's body has a dose it can contain, it can manage, it can detoxify. You understand that? Then people should increase their exercise. When you do the exercise, you reduce the cholesterol in the body. Generally, it is good. Exercise, then reduce obesity. Then people should eat things like fish. But in all these things, you also look at the economy. Can economy even allow people to eat ordinary food? Now, where we have not researched is the site, how things are processed in our environment. Even the fruit you buy, how do they process it? Do they chemicals they use? Those things, do they have effect? The fufu our people eat, the way they make it. If you really ask people inside the making, they may tell you that a lot of chemicals, a lot of things are done. So you notice that in our environment, there might be a contaminant to food we eat. And people trying to make gain. So some of these things are things that are modifiable primary prevention. Exercise, eat the fruits and vegetables, reduce milk, and reduce red meat. Yeah, these are primary prevention. Then when you talk about secondary prevention, it's talking about early detection. And that is why people should not go for, once you are of age 45 or 50, family history starting from 45, the person should go for yearly prostate screening to be done by an expert. I have seen somebody from my village, he had prostate cancer at 43.
Yes, of course.
I remember the father died. Yeah, 43.
Yes, of course.
The father died when I was small. The father died around age 48. But he died maybe, let me say, 30 years ago.
Oh, dear me.
So I didn't know what actually killed him because they are far from our place, but I knew he died.
So family members, 1 minute, sir. Family members, what Dr. Onibo is saying is that yes, they say 50, however, from 40, and I said this to you, I have people I know, they are 40, 43, 44, they have cancers, they were diagnosed, and they are being treated, they are 44. Don't think old age, oh, I'm young, I'm 40. Please start early, especially if you have a relative which is a high risk of prostate cancer. But sir, most times people will say, my dad does not have prostate cancer. My family does not have we don't have prostate cancer in my family. Also, sir, doctor, I want you to know that in Nigeria, we all have confirmed, you have told us that most men that are being brought to your clinic is their first time of coming to hospital. And because the prostate is now aggressive, that is why they noticed it and came. Meaning, some people may have actually died of cancer, but it was not diagnosed. So, can you talk more when you're talking about age? Because sometimes people die of cancer. They'll say, my family, we don't have cancer. My family, we don't have cancer. Yes. But because they never checked. They never checked. Did you check to say what you're saying? Continue, sir. So we are still on cures, on prevention. Because sir, if you don't mind again, when you were talking about prevention, and you talked more about antioxidants like tomatoes, leaves, greens. So family, I'm showing you, I'm stealing the presentation of Dr. Jonathan, who talked about prevention. In prevention, he talked about diet. In diet, he talked about antioxidants. In antioxidants, he talked about things like fruits and vegetables. He also talked about healthy omega-3 fats, seeds like nuts, salmon, fish, and others.
Rich, fish.
Yes. So also we have plants. That decreases the risk of cancer, soya-based diet, and also we have they talked about red meat, which is not good. I didn't hear you talk about that, sir.
No, I said it. People that are listening now. Okay. I said reduce red meat, reduce milk.
Yes.
Milk.
Yes.
I said red meat and milk.
Yes. Continue. So, family, you're asking prevention. Our renowned Dr. Onibo was not here last week, but because he's a super duper indigenous Nigerian doctor and he's so good, he said to me, is universal. Medicine is universal. You won't say it's UK based, because what they're teaching here in UK is the same thing they're teaching in Nigeria as well. So Dr. Onibo has collaborated with Dr. Jonathan to say, yes, prostate cancer can be prevented, and yes, check your diet. Yes, exercise is important. And I heard him say, and they say, risk, red meat. Be careful of red meat. That is one thing they say Asian people don't really do. That is why they almost have 1 in 13 as against 1 in 4, which is really, not acceptable. So, sir, can you talk now about cure? Can you tell us about cure and give us an instance when cancer can be cured?
Yes. Let me briefly just say.
So before you talk about cure, I want to say to you that a family member on the page, her name is Chinaza Igwe, said she's learning a whole lot tonight and that she is happy. Also, we have a family member, her name is Love. Love say what you're saying is so interesting and that she is happy about that. We have another family member, her name is Sylvia Okoli. She is asking, can we say most protein? I don't know. Did you talk about protein in terms of meat? Nigerians call meat protein.
No, I didn't talk. I said red meat.
Yeah. Most time when they want to say, give me meat, they'll say, give me protein. So, probably, yeah. So they are so happy. And let me read the last one. This is Moturayo. Moturayo Akin is a wonderful family member. She said, thanks for all you do for Los Angeles. Okay, she's thanking me for something else. So continue, sir. Is there a cure for cancer? And at what stage can you, sir, before you say this, quickly, most people, when we hear cancer, death, So we kind of align death and cancer together, as in if you have cancer, sorry, you're gone for life. But you say cancer can be cured. Not just can it be prevented, it can be cured depending on when you saw it or when you notice it. Can you tell us more on how can you cure cancer?
Okay. As I said at the beginning, it can be early or late.
Yeah.
Those that are early is what we call organ confined. It's like there is a bag that contains the prostate, a bag.
Yes.
Now, if that cancer is within that bag, we say it is organ confined. We say it's early prostate cancer.
Okay.
Yeah. If the person comes to the hospital and goes to meet an expert,
yeah,
the person can be cured of that prostate cancer. It means that the way I explain it to people is that the cancer is like a tree, a dead tree without leaves. It has become a wood. Now that's prostate. Now, if it has part of it, if it has a small fire on part of it, you can use a bulldozer to put that tree and throw it into River Niger. It means both the tree and the fire is no more to be seen. That is for early prostate cancer. But for late prostate cancer, it's like a tree, every part of it, the tree is dry and every part of it is on fire. You now call fire extinguisher. These are fire service people. They will come and spray water on it. The fire will go down. But inside of the tree, there is still fire. But a layman will pass and the person will not see any fire. The person will say, oh, everything is okay. After some days, especially during this hammer time, the fire will continue to grow. Before you know it, it has started spreading, affecting even filling station around it. So that is for advanced prostate cancer. Now, for curable prostate cancer, the person has to come early, meet an expert, and a lot of things will be done. Biopsy will be done and say, oh, this is prostate cancer. Some tests we'll call imaging, MRI, can now be done and say, oh, this is within the bag.
Sir. You're saying, I hear you, I understand you. You're saying two things together. So because you're saying two things together, let's separate them. So family members, we understand.
Okay.
So can you talk about the test before the cure? So I hear you say biopsy and MRI. And so you need to tell us, what do family members need to do?
Let me break it down. Sorry. Now, when the person presents to an expert, the expert will ask some questions using his hand put in the anus. As you said that in the beginning, that the prostate is just in front of the rectum.
Yeah.
So the expert will use his hand to feel that how the anus is. He may see that some things are not okay from his finger. He will now send for PSA, prostate specific antigen.
So, family, like 1 minute, sir. 1 minute, because I like breaking things for our family members. Family members, what Dr. Onuibo is talking about touching, he didn't mean they are gays. No, he's not saying a doctor is a gay, and when he see a man, he starts to romance the guy's what he's saying is they can do, I don't want to call the name, they can do a form of physical examination. So he's talking about testing for cancer. So there are many ways to test for cancer. One is the first thing he said, that they can physically examine you. So physical examination of your prostate, which is like examining your rectum to see if it's enlarged or whatever. So your anus, to see if there is any, what is it?
Anything
in it. Yeah, and digital, okay, you want to call it anus. So if there is, or if you can, sorry, repeat yourself. Can you repeat yourself? Oh, we've lost it.
No, I said okay. The prostate will be examined. The prostate will be examined, and the doctor will now report what he saw. then he will now send the person for investigation.
PSA. You said PSA second.
Yeah.
So one is physical examination. The second is a blood test. Continue, sir.
Blood test, ultrasound.
Ultrasound. What is the
Which they can
ultrasound?
also do. Now, the ultrasound, ideally, should be done from the anus because it is closer, the anus is closer to the prostate. Now, it will help the person doing the ultrasound to see the prostate well. After that, he may also check the kidney, check the bladder, you know. Then after all those things, with the PSA, if the PSA is higher than expected, it may be a basis that the person will undergo further tests.
Good.
So if the PSA
So, sir, when you say higher than expected, I know this is not something you will be able to say a particular figure.
No, let me say. Ideally, what we'll take is that the PSA should be 0 to 4 nanograms per ml.
Does it not matter regarding age as well?
The age, yeah, there is age factor there, but this is a normal range of PSA. If you are now considering the age, you now begin to look age-specific PSA.
Yeah. So, sorry, do you know why I'm worried? Because some people, their result for PSA is 2 point something, and they are consigned and they have to go for further tests. But I know the age range is 0 to 4. But 2 point something, people are now alarmed in certain cases.
Yeah. Now, the percentage of people that have prostate cancer at 2 point something is very small.
It's more, but there is. You see why I'm saying that?
Now, it can exist. That is why I said, apart from the PSA, the person will also go for ultrasound.
Fantastic. So, family members, what Dr. Onibo is saying is that there are many ways to check for cancer. We are talking about tests before we go to cure. So the test is physical examination, PSA, which is a blood test, and the normal range, which is not something very reliable, but that's what is the first sign, is 0 to 4. But again, there is age difference. For instance, if a young guy, anyway, let me not go in depthly on it. I'll let you continue.
Before now, what we'll do is, if we've done all these things and we have to feel the prostate is suspicious.
Correct.
Prostate biopsy, which is taking the part of the prostate from the anus to send it for the pathologists, those people that examine what is brought out from the body using microscope, for them to look at it and say, this thing, does it have cancer or not? That is just the bottom line of what they will do.
So the number 3, family members be writing it one by one.
Yeah.
You say, I want them to take notes.
There is something I want to say.
Okay.
But now, we now have magnetic resonance imaging.
Okay.
In our environment. Many people procured it. I think they have 2 in Onitsha. One is in Oka, one is in Enugu, one is in Nnewi.
So you're talking about MRI?
Yes, magnetic resonance imaging, because it can detect small cancer more than ultrasound. Okay. So what we'll now do now, before we do biopsy, we'll send the person for MRI. Now the advantage is that before you put in a needle, because the tract of the needle may be confusing to people that will report that MRI later. So before you do anything, send the person for the MRI. Let the MRI look at it.
Very important. Very important.
And say it's likely at the left, it's likely at this, then before the biopsy. So that by the time you are doing biopsy, you already know the stage, whether it is early stage or advanced stage.
Sir, I'm dying to say this. I love what you said. Very, very important, because I know somebody who I will not want to mention that did a biopsy test. And during the biopsy test, the biopsy went so wrong that it affected his erection for 8 months. Why is that the case?
The biopsy, well, is it in our environment or in developed country?
Is here. Is here. He did biopsy, and the biopsy went so wrong. Complication from the biopsy affected his erection for 8 months.
No, that's what I said. Is it in developed country or
Yes,
Nigeria?
is here.
Okay. Now, one of the things you need to find out is this person having erection before the biopsy. If it has been having, anything can go wrong, even to cough. Somebody may even drink water and the person will choke.
Yes.
And die from it. Yes. So anything can happen. You see car, people enter car, the car will have accident. They'll still use car to carry the victims to hospital.
Yeah.
So people will say, oh, because car is what had an accident. Because of that, nobody will enter car.
Yeah.
You understand that?
Yeah.
Complication can occur. And that is why to be a health worker, the person has to be very careful to make sure that the cause of the complication is not his fault. I don't know if you get me.
Of course, yes. Of course.
It can occur. It can occur. I did biopsy the other day, and the man said, oh, he could not pass urine. I put a catheter for him and told him 5 days he came, I removed it, and he was okay.
Fantastic.
So it is a complication of biopsy. But I used to explain to them that this thing can happen.
Yes, of course. Of course. Of course.
It doesn't happen to everybody.
No. Yeah. And I like the example you gave, that so an accident happened with a car. Does it mean a car, people shouldn't enter a car? No, it doesn't. It's just that it's very important for people to be told, which you also mentioned you did, that there could be complication in certain processes that has complication. Thank you very much, sir. You're wonderful. I love you. Continue. So let us quickly dive into cure. We will still come again, family members. We are going to stop at a certain stage. We will come again because prostate is so important. Because let's be honest, it's a large
topic.
It's a life topic. I agree. And do you know why? It is happening to more and more of people of my color. And this is all we can, sir. Doctor, I just called you today and you said, yes, you're in Onitsha, you're here, you're there, but you will make it tonight. I was like, are you sure? You said yes, because you are someone that is devoted in helping people. You tried your best to help my uncle, but like most of us, we usually go during the dying minutes when it's like a matter of death, not even life and death. That is when we go to hospital. That is why we couldn't help him. But I don't want what happened to my uncle to happen to my brothers, my family members. No, I don't want it. So that is why I'm dying, I'm struggling, calling people, getting experts in the field to come and talk. So continue, just 5 more minutes, then we will close. We'll come back again, sir, now, if you don't mind.
The curative treatment, the basic 2 curative treatment is that surgery, if the person is a candidate for radical prostatectomy. The radical prostatectomy can be done as open, it can be done as laparoscopic, using machines, using something. Then there is a robotic assisted laparoscopic.
Yes.
What we have here.
You're too much. Yes. Continue.
Now, what we have here, we are developing here is open prostatectomy. And just to tell you that the first case I did to a man in Umoji in 2018, the person came last month with a PSA of 0.06, very low PSA. That was in 2018.
Wow!
So now is like 6 years. Yes. Yeah.
Wow.
So open can be done. laparoscopic radical prostatectomy can be done.
Wow.
Robotic, but we don't really have robotic in Nigeria. Okay, there's one man that comes to do it from UK in Reddington Hospital. Robotic, Reddington, yes. Yeah. There is another person that does laparoscopic in Abuja. He gets experts from outside the country to do.
Wow.
Yeah, that's what we do here. What we do here is open prostatectomy, and for selected patients,
Wow.
when we do it to them, they do well, and they do well is because many of those patients, they come with urethral catheter. After that, the catheter will be removed, and the prostate cancer, like the one I showed you 6 years ago, the PSA is 0.06. Is not, so it is, for many labs, they cannot detect the prostate, the PSA. And the man is doing wonderfully well. But you could imagine someone that was, I think, 65 when I did it to him, and now he's 6 years. You know, well, how old he is now. So he's 71. I'm so happy, you know. Yeah. So surgery can be done, what they call radical prostatectomy, remove the prostate, remove the seminal vesicle. That is one treatment. Second treatment is radiotherapy. And thank God, Nigeria now have some places who can send our patients for effective radiotherapy. One is in UNTH Enugu. One is in SIA Route, Lagos. And they are very effective. It is like public-private partnership. So they don't even do it as a civil service work. When you come, the person will pay money, but they give effective treatment. One of my patients in Enugu here, he went to Reddington. Okay, they did biopsy for him. He went to Reddington. Reddington asked him to be coming for follow-up. But what book said is that Africans are not good candidates for follow-up when they have prostate cancer. Give them treatment. Because you may be trying to do the follow-up to see whether the cancer is progressing. They will come with advanced disease. I cannot cure again. So I canceled the man. He's from Enugu here. I canceled the man. He's a big man. He went to Lagos. And when they did the staging with MRI, they found out that it was almost escaping the capsule. And they gave him radiotherapy, placed him on hormonal treatment. The man every day, he sends me all those good morning, how are you doing? And he sends me messages, pictures.
Who wouldn't?
On daily basis.
I will stop here. Who wouldn't send you that? I will stop here and tell you to try and come back to the page. Let us greet you finally. We are going to stop here. This is all we can take because you've been running around. You told me you are tired. Oh, how long will it take? Oh, I want to rest. Oh, I'm going to excuse myself. But look at you going on and on. Thank you, Dr. Onunibu. And you're wonderful. Thank you for your service to humanity. Please let us stop here. But before we stop, let me dance for family members. We are going to have a part 3, and Dr. Onunibu will definitely be back. He will be back to continue from where he stopped. The guy is too much. Let me play this song dedicated to you, family members, from me and Dr. Onunibu, because we fit die for una matter. So, Dr. Onunibu, thank you very much. And please try and come back to Facebook so that, to the stream yet, so that we'll say bye-bye to family members. Is that okay, sir? Is that okay? Okay, he's no more here. All right. God bless your father. I think I love your mother. Baby girl, God bless your mother. Yes. So I'm going to start the dance. Ooh.
bless your mother. Baby girl, God bless your father. I feel I on top your mother. Baby girl, God bless your mother. You see my boss, mommy, water. Baby, bless your mother. Baby girl, God bless your father. You love me, make I love you, baby. Baby, kiss me, make I kiss you, baby. My baby, baby, let me love you, baby. Baby, kiss me, baby, make I kiss you, baby. Baby. Baby girl, you mesmerize me. I've been searching, and you finally found love. Yeah, baby girl, you take my heart away. I've been looking, and you finally found love. I would have kissed with you, baby, and go school for Germany. I find peace with you, baby, and I never leave you, my lady. I wanna please you, my baby. Buy you everything you need. Never bring your car from Germany. Give you mansion and money. Make you give me value. I gon' give you love, and I promise to give you value. I feel that on top your mother, baby girl, God bless your mother. You do my boss, mommy, mother, baby bless your mother, baby girl, God bless your father. I feel that on top your mother, baby girl, God bless your mother. You do my boss, mommy, water, baby bless your mother, baby girl, God bless your father. Love me, make I love you, baby. Kiss me, make I kiss you, baby. Baby, let me love you, baby. Baby, kiss me, baby, make I kiss you, baby. Lisa, Lisa, baby, I beg you, don't play me like that. Lisa, Mona Lisa, baby,
Yes, yes. So, like, this is all we can take for tonight. Dr. Anyway, is he not amazing? He's the doctor that treated my uncle before he died. I would say that we have to go. This is all we can take. I don't want us to be like what we did last week. You guys were crying. In our mind, continues to be in my mind. And your destiny is definitely in your own hands. Your cancer is in your hands. What do you have to do? Go visit the doctor. Check your PSA. Any male, if you're a man, a male. Very important. Don't wait until it's too late. You say cancer kills. Cancer can be cured. You just heard it from the horse's mouth. So let's go tonight. We'll come again for the part 3. We have a lot of questions. We need answers. And where else can you get your answers if it's not in our Mind Talk show? We, Nurse Angel, I love you guys. Bye-bye. Take care. Bye.